Hello all. Our today's topic from medical microbiology, study of bacterial pathogens, and our topic is Staphylococcus aureus, part 2. Today we'll study Staphylococcus aureus, a major bacterial pathogen, with respect to pathogenesis, laboratory diagnosis, epidemiology, as well as prophylaxis and chemotherapy. Now, in detail about pathogenesis of Staphylococcus aureus. As you know, these microorganisms are present as a commensal of human skin as well as in nares. Their mode of transmission and portal of entry is related with the same. That is, they transmitted from person to person. As they live on inanimate objects for long period, again chances from fomites to human being is possible. The infected patient is often a carrier of Staphylococcus, usually in the anterior nares. So while handling food, possibility of entry of these microorganisms in the food, that is contamination of it, may occur. Meat, fish, milk and milk products cooked and if left at room temperature after contamination with these organisms for enough time, there is a production of a toxin, and that is accumulation of a toxin in the food, which is the source of infection in case of a food poisoning. Here, food handlers may serve as a carrier of this organism. Staphylococcus aureus infection, when occur at that time, the lesions on the skin, they are generally localized type. The enzyme coagulase produced by Staph aureus inhibits phagocytosis and forms a wall of a fibrin clot, because of which it is not possible for the phagocytic cell to engulf them. Staphylococcal infections are classified as cutaneous infections, deep infections, toxin-mediated infections. Now we'll see in detail deep infections by Staphylococcus aureus. So here first infection is osteomyelitis. This is nothing but a infection of a bone marrow or infection of a bones. This is highly painful condition and pus get accumulated in the bone marrow in the middle portion of the bone, and it is very difficult to treat. Second infection by Staphylococcus aureus is sinusitis. As you know, tis means inflammation. There is a erythema as well as a edema, and here sinuses are involved, which is type of a respiratory tract infection. Third infection is tonsillitis, that is inflammation of a tonsils. Again, this is related with the respiratory tract infection. As you know, complication of this is otitis media also, that is infection of a middle ear, which is again type of a deep infection by Staphylococcus aureus. Next to this is a pharyngitis. Pharyngitis infection, inflammation of a pharynx, as well as there is an infection of a larynx because of this organism. This organism may cause pneumonia. It is one complication. Then there is an empyema, that is pyogenic infection by microorganism. Then inflammation of an endocardium, meningitis, as well as when involvement of a blood and other body tissues, septicemia. So in this way, osteomyelitis, sinusitis, tonsillitis, pharyngitis, pneumonitis, empyema and endocarditis as well as a meningitis and septicemia are examples of a deep infections by Staphylococcus aureus. This organism also causes infections of a skin. Here, these are called as a cutaneous infection, and these are characterized by pus-filled blisters. As you know, this organism is opportunistic pathogen. From cut, abrasion, they may enter in the body and cause various types of diseases of a skin as well as some other body parts. In the cutaneous infection, when there is a formation of a boil occur on the skin, their severity may increases and leads to carbuncles. So carbuncles, pustules, boils, these are all cutaneous infections. When they form pus in these boils, and when it spreads beneath the skin, there is a formation of abscesses. Sometimes they may infect the conjunctiva, and one can see styes also. That is infection of a conjunctival eye lining. There is an impetigo by this organism, as well as wound and burn infections, where the main mechanical barrier of the body, which is skin, when it get disturbed because of reasons like burning, etc., this organism may invade that burn and infect it. Pyogenic infection of a burn which are present on the skin, as well as this microorganism may enter through wounds which are already present. That is, again, mechanical barrier is disturbed, and so wound infection by Staphylococcus aureus. Every time one can see pus formation in all these types of lesions which are present on the skin. Again, it is highly painful condition, presence of a yellow colored pus with some abscesses as well as pustules. Number of other toxin-mediated type of infections are observed in case of a staphylococci. In that, staphylococcal food poisoning is included, scalded skin syndrome, as well as a toxic shock syndrome. Now, in detail, when infection occur of skin, cutaneous infection, there is a formation of a boil on the skin. It is also called as a furuncle. It is superficial skin infection that develops in a hair follicle, as well as a sebaceous gland or a sweat gland. This may be complication of a acne vulgaris. Here, as you know, in the boil, it is may filled with the pus and called as a pustule. When infection occur at the base of an eyelash, it is called as a sty. This is commonly observed in children. Infection can spread from furuncle with the development of one or more abscesses in adjacent subcutaneous tissues. The lesion is known as a carbuncle. That is, severity now increases. This occurs most often on the back of the neck, but it may involve other skin sites also. Carbuncles are serious lesions that may result in bloodstream invasion. That is, initially it is present superficially, cutaneous one, but when they gain entry into the blood circulation, one can see bacteremia, which is a serious type of infection in case of a staph. Chronic furunculosis is one more complication of staphylococcal infection. Some individuals are subject to chronic furunculosis, in which repeated attacks of boils are caused by the same strain of Staphylococcus aureus. Chronic staphylococcal disease may be associated with the factors that depressed host immunity, especially in patients with diabetes or congenital defects of a polymorphonuclear leukocyte function. That is, these are predisposing factors for the staphylococcal infections. One more type of a skin involvement observed, that is presence of a impetigo. This is nothing but a skin pustule. Here, this organism produces one toxin, exfoliating type of a toxin, which causes a bullous impetigo. This bullous impetigo is nothing but a large blister in the superficial layers of the skin. Can be considered a localized form of a scalded skin syndrome. Staphylococcus aureus can cause wide variety of infections of deep tissues by bacteremic spread from skin lesion that may be unnoticed. Means initially infection is present superficially, but later on there is an involvement of a blood circulation and possibility of an infection of many other organs by Staphylococcus aureus. These include infection of bones, joints, deep organs, as well as the soft tissues, including surgical wounds. These mainly occur in hospitals. So, nosocomial infections, a name given to such a conditions. More than 90% of the cases of acute osteomyelitis, that is bone infection, in children are caused by Staphylococcus aureus. Staphylococcal pneumonia is also very common. It is typically secondary to some other diseases like influenza. Means first pathogen is some virus, and as the immune status of that person lowers down because of this primary pathogen, the secondary invader is Staphylococcus aureus. At the deep sites, the organism has the same tendency to produce localized destructive abscesses that does in the skin. So, here life-threatening diseases may caused by this organism. Important disease caused by staph is cellulitis also, an infection of the deeper layers of skin which causes skin redness and swelling on the surface of skin. Staphylococcal scalded skin syndrome, one very important disease mainly in children by this organism. Here toxins are produced as a result of a staph infection. This may lead to this type of a syndrome. Affecting mostly babies and children, this condition features a fever, a rash, and sometimes blisters. When the blisters break, the top layer of skin comes off. See, name is scalded skin syndrome, which is related with this symptom. What is it? The blisters break and the top layer of skin comes off, and leaving a red raw surface that look like a burn. This is only because of that SST, scalded skin syndrome causing toxin. There is a reddening of the skin which is called as erythema, and intraepidermal desquamation which takes place at remote sites from which staph aureus cannot be isolated. That is, during this scalded skin syndrome, blood picture not show presence of organism because disease organisms are present somewhere in other parts of the body, but toxin may reach to the skin and show such a type of a syndrome. The disease occasionally occurs in adults, mainly in immunocompromised patients. One can see scalded skin syndrome, which is because of a low grade of immunity or poor immune status of the person. Mild versions of what is probably the same disease are staphylococcal scarlet fever. This is again important disease in which there is a reddening or erythema occurs without desquamation and a bullous impetigo, in which there is a local desquamation occurs. In case of a toxic shock syndrome, we have to consider some other symptoms including high fever, vomiting, diarrhea, sore throat, as well as a rash on palms and on soles. This resembles sunburns. There is a confusion as well as a muscle ache-like symptoms observed during TSS. Here, within 48 hours, this disease may progress to severe shock. So, toxic shock syndrome with evidence of a renal and hepatic damage. So, life-threatening in such a situation. This results because of a toxin produced by some strains of a staph and has been linked to skin wounds as well as a surgery. Surgery is also one type of a skin wound, and because of a contaminated instruments used during surgery as well as handling by the carriers of the staphylococci, possibility of an infection to the patient. Next disease caused by Staphylococcus aureus is septic arthritis. This is often caused by staph, where the bacteria often target knees, shoulders, hips, fingers, as well as toes. There is a swelling in joints, that is myalgia, and it is also called as a septic arthritis because of a sepsis in the joints of the patient. There is a severe pain in the affected joints, as well as there is a febrile illness, that is high-grade fever is observed in the patient suffering from septic arthritis by Staphylococcus aureus. The most important category by the enterotoxin producing Staphylococcus aureus is staphylococcal food poisoning. Here, ingestion of a staphylococcal enterotoxin contaminated food. This is preformed type of a toxin enter in the body. Contaminated food like milk, milk products as well as meat and meat products. Already organisms grow in such a type of a food, produces enterotoxin, and upon consumption of such a preformed toxin having food, there is a food poisoning. There is acute vomiting as well as a diarrhea within 1 to 5 hours. Usually there is no fever, as organism itself is not responsible for disease production upon entry of it in the body. There is no fever, but nausea, dehydration, as well as a low BP are some other symptoms associated with this. Recovery is rapid. Sometimes it is self-limiting, self-resolving type of a disease, except sometimes in the elderly people there is a chances of severe conditions because of such a food poisoning or some other predisposing factor like presence of some other diseases which lowers immunity of the person may lead to such a type of a food poisoning. So staphylococcal food poisoning, one more different type of infection or intoxication by the microorganism. But when there is an entry of a bacteria in body, then the disease is called as a bacteremia, presence of organisms in the blood circulation. This is also known as a bloodstream infection. Bacteremia occurs when staph enters person's bloodstream. There is a fever, febrile illness, low BP, these are signs of it, and the bacteria can travel to locations deep within the body via bloodstream. It reaches that particular organ and produce infections. Here number of internal organs may affected, and in that brain, heart, lungs, bones as well as muscles are included. So these are complications after bacteremia by staphylococci. So after all this, that is entry of microorganism and development of a disease, appearance of a clinical symptom, next step is of a identification of microorganism which is in the laboratory, which is nothing but a laboratory diagnosis. In the laboratory diagnosis, first we have to collect samples. So selection of a sample is important part. in the laboratory diagnosis of any type of a disease. So when there is a meningitis, requirement is of a CSF sample, that is cerebrospinal fluid. When there is an infection of a skin, from the skin one can collect pus sample or the exudative material present in the lesion in the abscesses. When deep tissue infections like bone marrow, at that time now this one is more critical to collect pus samples from the bone marrow. Here drilling is required to remove pus with microorganisms present in the bone marrow. When pneumonia, then in the patient's cough, in the sputum, possibility of a presence of microorganism. Okay, or aspirated fluid can be used for the same purpose. When diarrhea, because of a food poisoning, leftover food is collected as a sample. That means during different type of infections involving different type of systems, accordingly we have to collect samples from the patient. So laboratory procedures are mainly used to assist in diagnosis of a staphylococcal infections, and they are quite simple if samples are available readily, which is very difficult in case of a toxic shock syndrome. But during bacteremia, one can collect blood sample also. It is most acute. Untreated lesions may contain numerous polymorpholeucocytes, that is pus cells, and large number of a gram-positive cocci in clusters. So in microscopy also, you can observe these microorganisms in the sample if they invade that particular system. Staphylococci can grow overnight on blood agar, on nutrient agar, on mannitol salt agar. So you can easily identify after 24 hours golden yellow color colonies, and after that by using various biochemical tests. As you know, various tests which are used for identification of it in part 1. You can perform that and identify these microorganisms very easily in the laboratory. In that catalase, coagulase, urease test, they are also used directly from the colonies, which are sufficient for identification of organism. Antibiotic susceptibility test. This is again used in laboratory diagnosis because the emerging resistance of this organism to multiple antimicrobics. That is, as this microorganism is observed as a multi-drug resistant variety of organism, antibiotic susceptibility tests are also carried out in the laboratory, which help the physician to treat that particular strain of Staphylococcus aureus. Nowadays, emerging methicillin resistant strains are observed. They are resistant to methicillin as well as to the vancomycin, and based on that requirement of a proper treatment. So in the laboratory diagnosis, antibiotic susceptibility tests are also used widely. Deep staphylococcal infections such as osteomyelitis or deep abscesses present special diagnostic problem. As you know, they are in deeper sides of a body, as well as in case of a scalded skin syndrome, they may not present in the blood circulation. There is a problem in the diagnosis. So here, direct aspiration or surgically obtained samples in case of osteomyelitis widely used. Blood cultures are usually positive in conditions such as acute staphylococcal arthritis. That is, from the samples from bone marrow in case of osteomyelitis, from joints in case of arthritis, or from blood in case of bacteremia, one can culture them easily. In case of endocarditis, same, one can use blood cultures, but less often in case of a localized infection such as deep abscesses. So this is all about laboratory diagnosis, various biochemical tests, cultural characteristics are used in the identification of the microorganism. Coagulase test play important role in this case. Now about epidemiology of the staphylococcal infections. The basic human habitat of staph is anterior nares. So as you know, epidemiology is nothing but a study of that microorganism with respect to its habitat. We have to consider its habitat where they present. About 30% of individuals carry these organisms in this site at any given time, and rates among hospital personnel and patients may be much higher because nosocomial infections because of this hospital personnel. Some nasal carriers and individuals are source of infection to others. Here, bacteriophage typing allows tracking of strains during an outbreak, as epidemiology is a study of epidemics because of the pathogen, because of causative agent. Here, requirement of such a type of a tracking, bacteriophage typing. Community outbreaks are usually associated with poor hygiene and fomite transmission from individual to individual. Fomite, inanimate object. The use of same clothing of the patient may cause infection to other patient. So here, poor hygiene is also play important role in the spread of infection. Unlike many pathogenic vegetative organisms, Staph aureus can survive long periods of drying. For example, recurrent skin infection can result from use of a clothing contaminated with pus from previous infection. Hospital outbreaks, these are also called as the nosocomial outbreaks, caused by single strain of Staph aureus, most commonly involve patients who have undergone surgical or other invasive procedures. Here, catheterization also play important role in certain infections. A nasal or a perineal carrier among medical, nursing, or other hospital personnel may also be the source of an outbreak. Bacteriophage typing and pattern of resistance to antimicrobics, this is also called as a antibiograms, are used as a epidemiologic tools to detect carriers who may have initiated or contributed to continuation of the outbreak. So this one is worldwide in distribution, and all categories from children to elderly may involve in the infections by the Staphylococcus aureus. So how to prevent the infection by staph? So which is nothing but a prophylaxis, prevention. In patients subject to recurrent infections such as a chronic furunculosis, preventive measures are aimed at controlling reinfection and, if possible, eliminating the carrier state. So here this is cutaneous infection. One can prevent it after proper treatment. Clothes and bedding that may cause reinfection should be washed at a sufficiently high temperature to destroy staphylococci, 70% or a higher. That is, this much temperature is sufficient to kill this organism. Attempts to reduce nasal carriage more generally among medical personnel. Careful hand washing, that is, wash hands before handling food, is also important. Next one is next type of a prophylaxis is avoid sharing personal items such as towels, sheet, razors, clothing, and athletic equipments. Staph infections can spread on objects as well as from person to person. Wash clothing and bedding in hot water. Keep wounds covered. Staphylococcal infection can spread easily through cuts, abrasion, and skin to skin contact. In adults, the use of chlorhexidine or hexachlorophene soaps in showering and washing can help. Anterior nasal carriage can be reduced and often eliminated by the combination of nasal creams containing topical antimicrobials like neomycin, bacitracin, etc., and oral therapy with antimicrobics like rifampin, ciprofloxacin. This also helps. Methicillin and cephalosporin, as well as vancomycin, given during and shortly after surgery, may reduce the chance of infection, which is also called as an intraoperative infection, while minimizing the risk for superinfection associated with longer periods of antibiotic administration. So avoid sharing personal items such as towels, sheets, razors, clothing, and athletic equipment. Staph infection can spread on objects as well as from person to person. Wash clothing and bedding in hot water. This is again one way to prevent the infection. Keep wounds covered. Staph bacteria can spread easily through cuts, abrasion, and skin to skin contact. So in the treatment category, one can use same drugs which are used in the chemoprophylactic purpose, that is use of rifamycin, ciprofloxacin, etc. But in case of boils and superficial staphylococcal abscesses, if they not resolve spontaneously without antimicrobial therapy, requirement of a certain lotions. So at that time, use of a antimicrobial drugs for the local application. Those are more extensive, deeper, or in vital organs require combination of a surgical drainage and antimicrobials for optimal outcome. Here, Staphylococcus aureus is a gram-positive organism. And as you know, for treatment of a gram-positive organisms infection, normally use of a penicillin G, benzyl penicillin like antibiotics, beta-lactam drugs. But here, as this organism may develop resistance against it, like MRSA, methicillin resistant Staphylococcus aureus, requirement is of some other types of a drug. So although penicillin G is the treatment of a choice for susceptible strains, as there is a possibility of a penicillinase resistant penicillins, methicillin, napcillin, oxacillin, and first generation cephalosporin are more commonly used because of it. So with this, one can use some other drugs like vancomycin, clindamycin, erythromycin for the treatment of a staphylococcal infection. There is a synergy between cell wall active antibiotics like penicillin and the aminoglycosides like streptomycin. One can use both types of drugs, that is beta-lactam group of antibiotic and aminoglycosides for the treatment of staphylococcal infections. Such combinations are often used in severe systemic infections, that is when involvement of a bloodstream, that is systemic infections, when effective and rapid bactericidal action is needed. This is mainly for the immunocompromised host. Use of both types of drugs in the treatment of a disease. So we can summarize the staphylococcal infections, pathogenesis, laboratory diagnosis, as well as prophylaxis, where staphylococcal infection may cause disease due to direct infection or due to production of toxins. Boils, impetigo, food poisoning, cellulitis, and toxic shock syndrome are diseases that can be caused by this organism, Staphylococcus aureus. A growing number of otherwise healthy people are developing life-threatening staphylococcal infection. Treatment usually involves antibiotics and drainage of the infected area. However, some staph infections no longer respond to common antibiotics, as there is a chances of a development of a multi-drug resistance in some isolates of a staphylococci. So this is all about Staphylococcus aureus. Thank you all.